Joe Champney, and I am a music education student at the University of Houston. Today, I will be teaching the proper hand position clarinetists should use in their daily practice. The clarinet is regarded by many as a technical instrument, meaning that, especially in ensemble playing, the clarinetist is usually called upon to play some of the most technical and challenging lines of music. With 7 keyholes and 17 or 18 keys, depending on the model, the precision of technique demanded in the clarinet repertoire is possible, but without a firm grasp of correct hand position, a clarinet player may never be able to play challenging works such as Weber's Concertino or Carl Nielsen's Concerto for Clarinet. Secondly, our instrument is the medium through which we can communicate the musical language, so lacking a mature and developed hand position means we are cheating ourselves of achieving musical brilliance. Poor hand position can lead to tonal problems, technical problems, and the development of many bad habits. Though overlooked even by the most advanced musicians, hand position is absolutely instrumental in the success of a clarinet player. The thumb of your right hand should be placed under the thumb rest between the tip and the second knuckle. If you were to place your thumb under the rest between your first and second knuckles, this will not only cause discomfort, but it will also negatively affect the position of the rest of your right hand. Once you have your thumb correctly placed under the thumb rest, allow your other fingers to rest in a natural position. As you set your fingers on the tone holes, note that the fleshy pads of your fingers will be used to cover these tone holes. With your fingers still curved, there should be a straight line from the first knuckle of your index finger to your wrist. Also, the index finger should not be touching the rod on the clarinet, and the entire right hand should be slightly angled down to the clarinet so that you can easily use the 4 right side keys. Finally, a common problem with our right hand position is to play with straight fingers and a stiff, straight pinky. Remember, your fingers should always be curved, and your right pinky should be curved and resting on the low F key. The thumb of your left hand should be placed on the tone hole and slightly angled upward. This is to ensure that, when needed, you can tap the register key, also known as the 12th key on the clarinet. Next, as you do with your right hand, the rest of your left hand should keep its natural curvature. Allow your first 3 fingers to cover the tone holes, and remember to use the fleshy pads and not the tips of your fingers to cover these tone holes. Also, your curved pinky should rest on the low E key. Finally, your left hand should be angled down into the clarinet. This will ensure that you will be able to use the rocking motion of your index finger to tap the A flat and A keys with the second and third knuckles of your index finger. Proper hand position is pivotal in our growth as musicians. This fundamental and necessary aspect of our posture is something all clarinetists should refine with daily practice in front of a mirror and with tedious attention to detail. Without this appropriate practice and maintenance, clarinetists at any level of ability can and will develop poor habits concerning hand position.